Hello, beautiful people. Welcome back to my YouTube channel. It's your favorite nurse, Amara. Fibroid is a condition that affects only women, so it doesn't happen to men. So, what is uterine fibroid? What actually causes uterine fibroid? What are the signs and symptoms that when one sees, she will know that this may likely be this? Then, what are the precautionary measures? Is there any precautionary measures at all? Who are at risk of uterine fibroid? These and many more are the things that we're going to look out for in today's video. Sorry, I'll be looking towards this side often because my baby girl is sleeping here. So what is uterine fibroid? Uterine fibroid is a non-cancerous tumor. Now let me use a layman language. Uterine fibroid, or what people know as fibroid, is a non-cancerous growth that you found in the uterus of a woman or outside the uterus of a woman. Before the risk factors, I want to talk about the signs and the symptoms, the things that when you see it, you shouldn't just sit down and fold your hands and say that all will be well later. The first one on the list is a heavy menstrual flow. If you're watching this video and you know you don't used to have heavy menstrual flow, and from nowhere you start having heavy menstrual flow, and by heavy menstrual flow we mean that you are able to use at least 8 pads in a day, and not just that, you change this pad within 1 hour, you are changing pad, or within 2 hours your pad is already filled up. And sometimes not just the heavy menstrual cycle, sometimes this flow comes with clots. And the second one is abdominal pains. When you have abdominal pain and towards the area of your uterus, that is at the pelvic area, you are having abdominal pain. Then some people, there may not be abdominal pain, they may be having pelvic pain. You'll be having pains at the area of your pelvis. Then another sign is irregular cycle. There are some women that because of the presence of fibroid in their body, it tends to disrupt their hormonal makeup and makes them to have irregular cycle. That is irregular menstrual cycle. Irregular menstrual cycle is a case whereby you have 28 days this month, upper month you have 40 days, another month you may not see your cycle at all. So this is what I mean by irregular menstrual cycle. Then another sign is when you have pain during sexual intercourse, you know that you don't used to have pain, or having serious pain while the sexual intercourse is taking place. Then another point is you are having frequent urination, and let's say in a hot weather you are having frequent urination, something that can happen to some people when the weather is cold and you feel like something is pushing onto your bladder to make you to be going to urinate often. So another symptom also that most women actually see, those that don't see the ones that I've mentioned before, is that they start having abdominal distension or protrusion of the abdomen. They see that their abdomen is coming out. They know very well that they are not pregnant, they are not sexually active, or even if they are sexually active, they know that they are not they are not pregnant, but their abdomen is increasing. My baby is crying, excuse me. Their abdomen is protruding, and this woman is very much aware that she is not pregnant. So these few points that I mentioned are the signs and symptoms of uterine fibroid. Excuse me. But I want us to look at the risk factors. What are the risk factors? What are the things that can predispose one to have uterine fibroid? Number one is we have the family history. Those that have the family history of uterine fibroid, by this I mean, say your mom, your grandmom, your auntie, your sister, anyone that is close to you have had uterine fibroid. That means you as a lady or a woman is also at risk of having it in you may have it at risk. It means that it may or it may not come to you, but you are on the line, it may come or it may not come. Then another one is the cases of nulliparous women, that is women that have not conceived for the first time, that they are also at risk of this. And sometimes people say age. No, I don't talk about age often because I have seen a younger lady of 20-21 years that have uterine fibroid, as well as people that have already given birth that have uterine fibroid, and people that have not given birth that have uterine fibroid. The risk factor is not also related to your sexual life, whether you are sexually active or not. No, uterine fibroid doesn't look at that one. We have 4 types of fibroid. We have mucosa, subserosal, intramural, and pedunculated fibroid. So for the course of this video, I'm not going to start a kind of trying to explain into details each and every one of them. But what are the preventive measures? The preventive measures is to check yourself and present to the hospital on time if you see any abnormal thing with your cycle. With your cycle, in particular with your menstrual cycle. Don't play with your menstrual cycle as a woman. If you're watching this video, if you notice any abnormality, see that your period used to come just 2 days and you now notice that you are having your period for 7 days, or that you know that you are having just 7 days and it changed to 2 days, like any change that you see, please save some money and go to see your doctor. It's very important for you and for your health. And I wish you well if you are in this category. And until then, see you in our next video. Bye.